Good morning. I'd also like to thank Lives Lived Well and the Winter School for inviting me here to speak today. I also really enjoyed Ingrid's presentation. She always gives provides deep insight and communicates her understanding in this area. My talk is a little bit more of an overview of the size of the problem. So we have been working on examining alcohol's harm to others since about 2007, and we've used a variety of different methods. You should just go back and thank all of my co-authors as well. They've been, the hidden harm report wouldn't have come into being without their support, and we have a great team at the Centre for Alcohol Policy Research and Turning Point and the National Drug Research Institute, where I'm from. So we also have looked at some of the models in the literature, and our work has been informed by researchers and practitioners like Bronfenbrenner and Garbarino, who describe the ecological perspective in which the child grows within different systems, like a nest of Russian dolls. And this image, I guess, shows the child in the middle, protected by the mother and the wider family, friendship, community, and societal circles. And I guess workers in the AOD and the domestic violence fields form one of the middle-sized layers, and the broader environmental and policy worlds that we inhabit are represented by the large babushkas. Our model really focuses on the different roles and the ways in which alcohol can affect others. And harms to others include many serious roles and serious harms. For instance, child abuse, neglect and domestic violence at one end of the spectrum, and also more what we call nuisance harms, for instance, noise at night and broken glass that needs to be cleaned up by council workers and neighbours. And so there's a range of different harms. And the roles, drinkers can affect their own lives, but also their workmates, strangers in the street, their friends. And in this presentation, I'll be particularly looking at how they affect children and families. This is one report in a longer series of studies that we've undertaken. And I'm kind of going to skip ahead to Chapter 6 of the report just to give you an understanding about what some of the harms that we've seen. In Chapter 6, Liz Manton and Sarah McLean, they interviewed a subset of people who had been interviewed in the quantitative survey, and so they talked about the ways in which they spoke to women and men who talked about the ways in which their other family members had been affected. So a grandmother reported that her daughter's husband had dropped their babies when he was drunk and stated that it could not be trusted not to drop them again. There were really severe incidents of threatening violence where Yvonne's son held a knife to his younger brother's throat when he was drunk, but didn't actually cut him. But it's still an awful incident. Then there's incidents where people talk about them being worried by their other members of their family driving their children, and then there's a lot of verbal and abusive language. And I thought Ingrid's comment about how important verbal abuse, how significant it can be, was really important, because sometimes I think verbal abuse can be minimised. So there's some of the more serious harms that we found. And that's the kind of things people were talking about when we talk about the numbers. Now, these were all from people who reported that they had been affected a lot. We did ask people in the survey whether they'd been affected a lot or a little, although sometimes people minimised. I think the second incident was actually said that respondent reported that they had only been affected a little. So sometimes people will minimise the effects of their harm. But the majority of harm where people reported that they had been affected a little, it might have been one incident or two incidents of verbal abuse. So I skipped ahead and come back again, but now these were our main research questions. We asked how common and what are the effects of heavy drinking upon families and children? To what extent do the effects upon children and families persist or change over time? What's the qualitative nature and the impact of harms, which was Chapter 6, which I've already done. And then there were what services are available for families and children if they have been affected by the drinking of those around them, and what types of services and policy interventions are likely to improve the situation of those affected by others drinking. So we used multiple methods. We included statistics and stories. So we surveyed over 2,600 Australians and asked them about how they had been affected by others drinking in a range of different relationships. In 2011, we followed up, unfortunately, around 40% of those who agreed to participate the first time, and asked them whether these things were still occurring. And there's a qualitative study that I've mentioned. We also, in this report, draw on the registry or the formal statistics that we collect across government and non-government agencies, and collated how many people seek help from what places and where. So we went to places like Child Protection Services and the police, and where we could, other family services. We also asked experts in the field what they thought were the best ways, what were some of the problems, what were some of the concerns in collaboration, and how they could work together better, and what would work best to improve the situations of these children and families. So when we look through the population survey window, which is now back in 2008, we found that 17% of people reported that they were affected by a relative or an intimate partner's drinking. 7% of all Australians, given that this was a reasonably representative sample, reported that harm was from someone that they lived with. 8% reported that they had been affected substantially. And when we asked them whether they were affected again, 50% of those who were affected the first time were still being affected in some way by a family member. And some of the things that we asked people about was whether they felt emotionally hurt or neglected because of someone's drinking, whether they'd been in serious arguments without physical violence, whether they felt threatened, whether they were physically hurt. And so there on the slide you can see that, in general, considerable proportions of Australians have been affected, and this is just in the last year. We asked about whether children had been affected as well. We didn't ask the children directly, so we spoke to the carers of the children. That was either an adult in the household with the child, or if they were separated from their child, they might report on children that they were not living with but had parental responsibility for. And so, 1 in 5 of these carers reported that their children had been harmed by others drinking in the last year. 3% reported that this harm had been substantial, and again 35% of the children that were harmed in 2008 were harmed again or still being harmed in 2011. And we asked whether children were yelled at, criticised or verbally abused, whether they were left in unsupervised or unsafe situations, and whether they witnessed serious violence in the home. I think I've really gone through that. So this is this sort of draws out a little bit what predicts that harm, that persistent harm, and we found for both family members and for children that it was living in a heavy drinking circle, so living in a household that had more family drinking, more family members drinking, or relatives drinking, that these kinds of things predicted that they were more likely to be persistently harmed. So now turning to the societal response agencies, where we aim to report on the police and intimate violence incidents, where we report on collate the child maltreatment cases, where carers are reported to have abused alcohol. We look at alcohol and other drug services, as well as online counselling helplines and those kinds of organisations. We kind of grabbed the low-hanging apples. We pulled together whatever we could find in the published literature, although I did more intensive work on the Child Protection Service in Victoria, because that was the topic of my PhD thesis just recently. So when we look at the family violence incidents, we can see that alcohol-related family violence, there seems to be more alcohol-related family violence in Victoria. The rates are higher in Victoria. I'm not quite sure why that would be the case. It may have something to do with reporting. I think Victorian police have for a long time had an alcohol flag that they use to record the incidence of alcohol in all family violence incidents, or they can report yes or no. We also can see that the rate is increasing in Victoria, Northern Territory and potentially WA, although that's not the case in New South Wales. And there are there are around 30,000 incidents of alcohol-related family violence in say 2012 and 2013. So these are in total across the 4 states, and we don't have data for alcohol-related family violence incidents, as far as I could find, in Queensland, in Tasmania, or in South Australia. No, yes. Though I'm happy to be corrected if there is information there. Now I'll turn to the child protection system, and in each year around 10,000 children, so this is data for 5 years on this slide, but in each year around 10,000 children and 19,000 cases, over 19,000 cases of child protection are managed that involve alcohol abuse by the carer or the perpetrator. We can see as children and families move through the system, we don't know very much about what happens to at the notification stage, how many of the cases that are notified but that don't then go on to further in the system, how many cases involve alcohol. It's interesting because in New South Wales they only know what happens, they know largely what happens at the notification stage, but they don't continue to gather alcohol data throughout the process, or not that's reported electronically in an easy to get at way. And so in the child, this is again the Victorian data, as families move through the system, you can see and the types of interventions that become necessary as they become more serious. You can see that that the level of alcohol involvement increases from 33% in substantiated cases to 42% in those cases that include court orders and may need removal of the child. So this is a little bit about the alcohol or other drug treatment services that are provided, and this is from the National Minimum Data Set from the Australian Institute of Health and Welfare. And you can see that generally quite a small proportion of treatment services are provided for other people rather than the drinker. And we don't know whether these other services are provided with the aim of improving the drinker's drinking or their drug use, or whether they're provided for the other per se. So I think we need better data in some of these areas. We also know very little about how different services refer to each other. So this is a little bit about alcohol-only online services that are about telephone helplines, and you can see that the Family Drug Support is a national agency, and that's seeing an increase in the number of people that are calling up about other people's drinking. That's actually an organisation that's set up specifically for to support those around people who use alcohol or other drugs. Whereas these other services are seeing steady or declining levels of people reporting about other people's drinking to the general lines that take all kinds of alcohol and other drug treatment concerns. So there was a lot in this study. It's taken a long time to bring it all together, but we also spoke to researchers and service providers from the AOD and the child protection sectors, and some reported that there is a consistent message about alcohol. Its presence, overuse and misuse permeate child protection. It gets tangled up with drugs, with them amplifying the effects of each other. I'm not sure they can be distinguished. So sometimes this notion of whether it's alcohol or other drugs is difficult to pull out. Yet there was the feeling that alcohol really was one of the single largest threats to the well-being of children, and there was concern that sometimes adult services don't address the issues of the child. I think the situation is improving, and I think, for example, in recent changes in Victoria have meant that the online screening systems automatically ask whether or not the client has children, and so that can then work to ensure that the needs of those children and other family members are met. On the sort of from the other angle, child protection workers are not really encouraged to know a great deal about alcohol or encouraged to work with the AOD sector, and there was this opinion that the sectors were quite compartmentalised, but there was work to try and bring this down. To break this down. Yeah. So, I mean, there was also a concern that some of these long-term issues were difficult, and that they were that the outcomes for children were appalling, as one of the key informants reported. But they really saw that there was a desperate need to try and engage families in services and get them to understand that and develop interventions that were successful. And thinking about those types of interventions, simplistically, there's really three ways that these interventions basically work. I mean, they can change the drinking of the drinker, which might be hard. They can fortify or treat the other and support the person who's affected, or they can insulate contact between them, so they can separate them, and so families can be supported to move away from a person who is causing them a lot of pain and suffering. There are really hopeful signs, I think, of how I've highlighted some of the problems, but I think some of the agencies and the sectors are beginning to work together. They're building capacity, building bridges program. I think Anne Roche's program, who will speak next about, actually I'm not sure what you're going to speak about, but how people, about improving family-sensitive practice. I think these are really exciting ways that the sectors are coming together. I think there are groups at risk which are still not really well managed by the systems, and it's, I think, even from the child protection sector, they don't want to see more children and more families channelled into the child protection system. That's already a system that's under an incredible amount of strain. So I think some other initiatives like Child First in Victoria, where people are people are directed towards services that are not child protections. There's less stigma around those services, and there's more I think generic family support available that can support families to sometimes to stay together or to make the changes that they need to make. And so sort of trying to bring all of these things together and look for solutions. I think the public health model, informed by the ecological model, really has something important to say here. So, for example, in the Tier 4, which I think you can read, I hope, that's all children in across Australia. The third level is that children are affected in some way by others drinking. So the figure that over 1 million children are affected at least a little by other people's drinking are those children that are affected by one instance of verbal abuse in the last year. So these children are affected, but not as greatly affected as those that appear in the higher levels of the pyramid. And so we see 142,000, or 3% of children are substantially affected, and then we see 10,000 children in 1 year in the child protection system where a carer's problematic drinking is a factor. And I think when you sort of bring in the primary prevention approach, we can perhaps think about limiting availability, increasing price, and decreasing advertising to make alcohol generically less available, less desirable across the community. That means that the follow-on effect will be some of those instances won't occur. Then I think in the second layer we've got children and families that are at risk, that need really great AOD services, that need good support for domestic, as well as then in the final layer those children that are in the child protection system, they need, intensive parenting programs. They need shelters if instances become too, if the violence is too great. They also need proper single parent pensions. There's a whole range of ways. It's a multifactorial approach that needs intensive parenting skills also need to come into play. So I think this tries to draw that data and the interventions that you might use across different levels together. So finally, harm to children and families from others drinking includes sporadic exposure to less than ideal parenting practices and family life experiences at one end, and ongoing serious forms of violence, injury and emotional abuse at the other. The data are brought together in a single frame using the public health approach and describe the range of problems that children and families experience. I hope that we can find funding to investigate and truly evaluate different interventions at each of these different levels and find out which of these solutions may be most effective. Again, I'd like to thank all of the survey participants and the key informants and the advisory group. Thank you.